I'm starting the recording now. So like I said, for anyone that's joining new, if you could please write in any questions that you have throughout the webinar on the chat, and I'll answer them at the end. My name is Maya Schoenbach. I will be talking to you today about body-focused repetitive behaviors in children and adolescents. We'll be talking about some treatment and some the background of it. So let's get started. Oops. Okay. So today, what I really want to focus on is really an introduction to body-focused repetitive behaviors. What are BFRBs? We'll talk about their impact on daily functioning, self-esteem, and quality of life, specifically for children and adolescents. Talk about the psychological and emotional factors and their influences. We'll talk about a specific model of BFRBs, of emotion regulation, as well as some comorbid mental health conditions. We'll talk about them. Then specifically within children and adolescents, we'll talk about signs and symptoms, ways you can notice if there is a BFRB in your child, and the challenges of assessing them specifically. Then we'll go deep into some evidence-based treatment approaches and the importance of early intervention, and then some challenges and obstacles to treating them specifically in this population, some relapse prevention strategies, which is always important. We'll do a short conclusion, and then we'll have time for some questions and answers. Okay, so body-focused repetitive behaviors, they are a group of psychological conditions that are really characterized by repetitive self-grooming behaviors that ultimately result in bodily damage. And there's two most common types. And the first is trichotillomania, or hair pulling disorder. And that the Diagnostic and Statistic Manual, which is the book that we use in order to diagnose various mental health disorders, it defines trichotillomania as the recurring pulling out of one's hair, and that it leads to noticeable hair loss and potential damage to the body. And then the second most common type of BFRBs is excoriation disorder, or skin picking disorder. And that involves repetitive picking out at one's skin, and it results in skin damage, scarring, and infections. And two key elements to both of these diagnoses is that there's a repeated attempt to decrease or to stop the behavior. So that's really important, that there needs to be some want and some action taken to actually try and stop it, but they're unable to. And then also that there's a significant emotional distress or an impairment in function, which could be social, which could be in education, the child's education, it could be in work. So those are two key areas that are important for both of these diagnoses. So BFRBs are relatively common in children and adolescents, and they have a very significant impact on their well-being. So prevalence rates, they vary depending on the specific BFRB, as well as the population being studied. So trichotillomania, or hair pulling, the prevalence estimates range, again, depending on studies, from 0.6% to all the way up to 4% in children and adolescents, which is very high. And excoriation disorder, or the skin picking disorder, the prevalence range are even higher, from 1.4% all the way up to 5.4% in this age group. So studies suggest that BFRBs, they often emerge during childhood or adolescence, and they have an average age of onset of around 9 to 13 years old. Again, more research really needs to be done because there's various studies with various conflicting ages. But here, what you can see here on this histogram, it's taken from a study of pediatric trichotillomania. And so this is a histogram of the age of onset of the hair pulling disorder. And so here you can see that the average age of onset was around 9 years old. And what's interesting here is that there's actually a bimodal distribution, or distribution with two peaks, with one peak of onset of around 7 to 8 years old, and the other onset is around 11 to 12 years old, which is around the age of beginning of puberty for girls. So maybe that's a factor. And also, interestingly and sad, is to see that the onset of hair pulling can occur as early as age 2. So that's what you see here on the left. And it's important to know that BFRBs really can continue for a lifetime. So BFRBs, they can have a profound impact on daily functioning, self-esteem, and overall quality of life of children and adolescents. So in terms of daily functioning, BFRBs, they can consume a significant amount of time. They can take up a lot of attention and energy, and this can really affect academic performance, social activities, daily routines, and children might experience difficulties concentrating, completing tasks, or participating fully in school and extracurricular activities. BFRBs can negatively impact self-esteem, as well as self-image, and this can lead to feelings of embarrassment, shame, social withdrawal, and children and adolescents may experience increased self-consciousness about their appearance due to their hair loss or the scarring or the visible skin damage. So it could be one could lead to the increase of the other, and then it can lead into a vicious loop. BFRBs can strain social relationships, as the child or the adolescent may feel embarrassed or anxious about others noticing their behaviors or the actual physical manifestations. And they may experience feelings of isolation, anxiety, or depression related to their BFRBs. And we'll talk a little bit about that later. So research basically shows that children as well as adults with BFRBs, they experience significant physical and emotional and functional impairment. And like I said, that's part of the criteria is decreased ability to function. And there's high rates of comorbid anxiety and depression. And BFRBs really can limit overall quality of life, limit participation in activities, reduce enjoyment, affect emotional well-being. And so kids and adolescents may face challenges developing a positive self-identity and engaging in age-appropriate experiences because of their BFRBs. So emotional triggers and underlying psychological factors really play a significant role in the development and maintenance of the BFRBs in children and adolescents. So in terms of emotional triggers, stress and anxiety is a main element here. So BFRBs are often thought to serve as maladaptive coping mechanisms for stress and anxiety. So emotional triggers like academic pressure or family conflicts, social stressors, these can all exacerbate BFRB behaviors. And then boredom and inactivity is also really important. So BFRBs may arise as a way to fill time or to relieve their boredom. And so a lack of engaging activities or stimulation can contribute to the initiation and really the maintenance of BFRBs. And then in terms of psychological factors, so children and adolescents with BFRBs, they often exhibit perfectionistic tendencies. So they strive for control and order, and really the BFRBs can be like a manifestation of these perfectionistic tendencies, and show a need for a sense of mastery and symmetry sometimes. And then in terms of emotion regulation difficulties, we'll talk a little bit about that next, but BFRBs may develop as a maladaptive strategy to regulate emotions and alleviate overall emotional distress. And difficulties in identifying, expressing, and coping with emotions contribute to the persistence of BFRBs. So negative body and image and low self-esteem can contribute to the development also and the maintenance of BFRBs. And like I said earlier, it can be like a vicious loop because BFRBs may become a means of coping with these body-related insecurities and may be used as a maladaptive way to seek temporary relief. So now I want to talk a little bit about the emotion regulation model of BFRBs, because this is very specific. It's also very relevant to children and adolescents. So emotion regulation, it refers to the ways in which people identify and respond to emotional experiences and the processes through which the people influence the experience and the expression of our emotions as well. So the emotion regulation model of BFRBs, it proposes that individuals, and then specifically children and adolescents with BFRBs, they initially have difficulty regulating their negative emotions, and then they engage in these body-focused behaviors in order to avoid or to alleviate the negative emotions. It's called aversive affect sometimes in literature. So negative emotional experiences are thought to trigger the BFRBs, and then the relief that there is experienced from the negative emotion, it actually maintains and then reinforces the behavior. And so it's thought that there's a negative reinforcement, but there's also a positive reinforcement from the stimulation as well. So it's doubly reinforced. And the emotion regulation model, it further suggests that individuals with BFRBs are overall, like I said, characterized by a general deficit in emotion regulation. So episodes of BFRBs really are hypothesized to result from a drive in order to stop experiencing a given emotional state, and really a lack of alternative methods for coping. So BFRBs often co-occur with other mental health conditions in children and adolescents. And main ones are anxiety disorders and obsessive compulsive disorder, or OCD. So BFRBs frequently coexist with anxiety disorders like generalized anxiety disorder, or GAD, social anxiety disorder, as well as separation anxiety disorder. So anxiety may contribute to the development of and maintenance of BFRBs. And BFRBs, like I said, again, it's this vicious cycle. BFRBs can increase the anxiety levels as well. BFRBs share similarities with OCD, or obsessive compulsive disorder, in that they involve repetitive behaviors, as well as heightened distress. So children and adolescents with BFRBs, they may experience obsessive thoughts related to their behaviors, and this can lead to the cycle of engaging in the BFRBs. So overall, both the anxiety disorders and OCD, they often involve excessive worry, fear, and a sense of uncontrollable thoughts or urges to do a certain behavior. And BFRBs really can be triggered or exacerbated by anxiety or obsessive thoughts, like I said, with this vicious cycle. So recognizing signs, symptoms, and behaviors associated with BFRBs in children and adolescents really is crucial for early identification and intervention. So some common signs and symptoms include excessive hair loss, bald patches, or uneven hair length, which could be indicative of hair pulling or trichotillomania. Also frequent skin wounds, scabs, or scars, which could be indicative of skin picking or excoriation disorder. And distress or preoccupation with physical appearance that may be indicative of it. And I think a big one really is difficulty resisting the urge to engage in the behaviors in either hair pulling or skin picking behaviors. And then in terms of behavioral indicators, you might see frequent hand to head or hand to skin contact. And I think I mentioned this early, it's important, is that it can happen anywhere in the body. It doesn't have to happen in the scalp. It can occur in the eyelashes, eyebrows, and not just on the face. It can be on the arms, anywhere on the skin or the hair. And then as well, hair twirling, inspecting hair strands or examining skin, isolation or withdrawal in order to go and engage in BFRB behaviors, so not taking part in social situations, and then really attempts to conceal or hide the affected areas. So maybe wearing hats, wearing long sleeves in the summer, wearing long pants in the summer if it's that maybe into school. So that's really important to watch out for that. And then for emotional and psychological signs, so there's increased stress, anxiety, or tension before or during the BFRB episodes. Also, feelings of shame, embarrassment, or guilt are often associated really with the behaviors. And like we talked about earlier, there's an a strong impact on self-esteem, on body image, and really on the overall quality of life. So it's important really to observe the patterns of your child's behavior. So it's important to see if you notice any repetitive or ritualistic behaviors specifically related to hair pulling or to skin picking. Try and see if you notice or observe any changes in behavior, in mood, or in social functioning. Like we said, that could be a sign or symptom. And really, this is the first step towards treatment, is tracking the frequency, the duration, and the triggers of BFRB episodes. That's really to get as much information as you can, and then ideally take it to a therapist or start using it to monitor the episodes and the behaviors. So recognizing and assessing BFRBs in young individuals, it really poses specific challenges. So in terms of maybe a lack of awareness, many parents, caregivers, and even healthcare professionals, they may have limited awareness of BFRBs. And if there's a lack of awareness, it can lead to under-recognition. And in terms of normalizing the behaviors, BFRBs may just be dismissed as a phase or as a bad habit. And this can delay proper assessment and then ultimately intervention. Behaviors like hair pulling or skin picking, they can often just be mistaken for common childhood behaviors, and then they're accidentally normalized and they're misinterpreted in that way, and then the child won't get proper help. So in terms of embarrassment and shame, so young individuals might feel embarrassed or ashamed of their BFRBs, and that can make it difficult for them to disclose their behaviors and seek help. And yeah, fear of judgment, fear of stigma, it really can hinder accurate assessment and diagnosis. So some young individuals, they may engage in strategies to hide or conceal their BFRBs, making them less noticeable. And that's what masking behaviors are. So like I talked about earlier, using hair accessories like hats or specific head bandanas, clothing, or strategic positioning of the body in order to hide specific areas, it really can mask the physical signs of the BFRBs. So like I said, that's called masking behaviors. And then finally, limited communication skills. So young children may have limited verbal or expressive skills, and it can make it challenging to communicate their experiences and their emotions related to their BFRBs. So now I want to talk a little bit with you about evidence-based treatment approaches, because they really are crucial for effectively addressing BFRBs in children and adolescents. Okay, so CBT is the most widely studied and highly recommended treatment for BFRBs. So for children and adolescents, CBT involves age-appropriate modifications in order to really enhance the effectiveness of the treatment. So developmentally appropriate techniques can include using age-specific interventions like play therapy, art therapy, or creative expression. And this can be done in order to engage the young individuals in their treatment. So for psychoeducation, which is a key concept, a key element of CBT, so it's important to educate not only the child or the adolescent, but also their family about the BFRBs, about triggers, about their maintenance factors. And really parent involvement involves collaborating with their parents in order to provide support, to reinforce the treatment strategies, and really to ultimately promote a supportive home environment. That's a key element that we're going to talk about some more. So behavioral strategies, so teaching skills like self-monitoring and habit reversal, specifically tailored to the child or adolescent's developmental level. So habit reversal training, or HRT, it teaches awareness of BFRB behaviors And it really works on the premise of competing responses and stimulus to control in order to replace the BFRB. So that's really, HRT is considered the first line recommended treatment for BFRBs. So in terms of cognitive restructuring, it's important to adapt cognitive techniques used for BFRBs in age-appropriate ways in order to address the distorted beliefs, negative self-perceptions, emotional regulation difficulties like we talked about. And then in terms of social skills training, so it's important to help children and adolescents develop alternative coping strategies, assertiveness skills, healthy social interactions, because like I said earlier, often social functioning really is impaired. So something that I wanted to talk a little bit about that's kind of like a peek at Skin Pick and Trick Stop's parent program, which is our programs. So there's something we use called Dragons and Talents, and it's a technique that can help your child really put their psychological life into words. And so it uses metaphors that are age appropriate and intuitive for them. And so why is it called Dragons and Talents? So dragons are all those kinds of behaviors that come up when things get rough. So it can be anything from a conspicuously timed tummy ache to full-blown tantrum. And then talents, on the other hand, are really whatever the child sees as their gifts, as their skills. And so using these metaphors, it really helps the child connect to their inner world and be able to communicate their emotions, specifically around their BFRBs. So ACT, or acceptance and commitment therapy, it's a therapeutic approach that can be tailored to the unique needs of children and adolescents with BFRBs. So ACT focuses on acceptance of distressing thoughts and emotions, and it has a key element of being committed to value-driven action. So being committed to your values. So developmentally appropriate language and metaphors is crucial, like I said, in order to explain the concepts and really to engage the young individuals in the therapeutic process. So teaching mindfulness skills to increase awareness of their urges, of thoughts and emotions without judgment, that's key in ACT, and it can be done for any age. There are classes on mindfulness for many age groups. And like I talked about, value-based action, so helping the child identify their personal values and then engage in behaviors that really align with those values, even in the presence of a BFRB urge. And then acceptance, so encouraging the acceptance of uncomfortable, distressing thoughts and emotions associated with the BFRBs, rather than trying to get rid of them and trying to eliminate them by doing the picking or the pulling behaviors. Behavioral activation really is key, so helping the young individual find meaningful activities, engage in positive experiences in order to enhance their well-being and reduce their overall reliance on BFRBs. And like I spoke about earlier, family involvement is crucial. Involving parents or caregivers in the treatment really is crucial in supporting the child or the adolescent practice their ACT techniques at home, and then again to create a supportive environment. So family involvement, like I talked about, is a valuable component of treating children and adolescents with BFRBs. So for family-based interventions, like I spoke about in CBT, educating the family members about BFRBs, so to include their causes, symptoms, and available treatment options, teaching effective communication skills within the family in order to foster understanding, support, open dialogue about BFRBs, encouraging family members to provide emotional support and to reduce stressors that may be contributing to the BFRB behaviors in the child. It's important to collaborate with parents in order to establish consistent and appropriate consequences and rewards to BFRB behaviors in behavior management. Sometimes that can help. And in terms of problem-solving skills, assisting the family in developing strategies to address challenges and problem solving related to the BFRBs. And then in terms of emotional support, providing emotional support to the family members to help them cope with their own emotional reactions and better support the child or adolescent. Because if the parent is emotionally regulated, then they can better help emotionally regulate their child. And then sibling involvement. We haven't talked yet about siblings. So engaging the siblings in the treatment process, helping them understand, understand and provide empathy, support for the young sibling or the older sibling, the child or adolescent with BFRBs. So in terms of pharmacotherapy, I want to start with a little asterisk. There really currently is no FDA approved drug for BFRBs specifically, but pharmacotherapy can be considered in certain cases, particularly when BFRBs co-occur with other mental health conditions or when other treatments haven't been effective. But specifically for children and adolescents, it's crucial to consult with a pediatric psychiatrist or child and adolescent psychiatrist. So seeking the expertise of a specialist who can assess the appropriateness of the medication and provide guidance on dosage, on monitoring, it's essential. So selective serotonin reuptake inhibitors, or SSRIs, these are the medications that are often prescribed to help reduce symptoms associated with BFRBs and really the co-occurring conditions like anxiety or depression. But again, I want to emphasize an individualized approach. Medication decisions should be made on a case-by-case basis, considering the specific needs, the specific risks, potential benefits for every single child on a case-by-case basis. And then again, regularly to monitor, ensure ongoing assessment of the medication, the effectiveness of it, the side effects, and then to make adjustments as needed. And really, I just want to kind of hammer home the take-home message is that treatment should be, regardless if it's pharmacotherapy, ACT, CBT, treatment really should be tailored to the individual's needs. And ultimately, it may involve a combination of approaches. So for example, in our programs in Skin Pick and Trick Stop, we use a combination of CBT and ACT. So sometimes that's what's needed. So early intervention plays a crucial role in minimizing the long-term effects of BFRBs in children and adolescents. So early intervention, it helps interrupt the cycle of BFRBs because it helps identify triggers, address the underlying emotions, and develop overall healthier coping mechanisms. Intervening early, it prevents BFRBs from becoming deeply ingrained habits, and it makes them ultimately more responsive to treatment, and prevents habituation. Early intervention supports the emotional well-being of the child or the adolescent. It can reduce the impact of BFRBs on self-esteem, on social functioning, and overall help improve quality of life. And then finally, early intervention really increases the likelihood of a successful treatment outcome because it allows for timely access to appropriate interventions and allows for therapeutic support. So BFRB treatment for children and adolescents, it can present specific challenges and obstacles both for patients and for the specialist therapists. So like we already discussed, BFRBs in children and adolescents, they may go unnoticed or be misattributed to other behaviors, and it can ultimately delay an accurate diagnosis and finding of appropriate treatment. And also, like we said, children and adolescents may have limited insight into their own behavior, making it hard and difficult to assess and treat the BFRBs effectively. So in terms of age-appropriate interventions, therapists, like we talked about, therapists need to adapt the treatment techniques to be developmentally appropriate, to be engaging and understandable for the young individual. Limited treatment options overall, there really is a shortage of specialized therapists who are experienced in treating BFRBs, and then specifically in children and adolescents. So this might lead to limited access to evidence-based treatments overall. Resistance to treatment. So some individuals may resist coming to treatment or have difficulty engaging in the treatment. And really there is a reinforcing nature of BFRBs like we talked about. So maybe that could be a reason why, or they have an overall lack of a motivation in order to change their behaviors. Young people, like we talked about, may have heightened self-consciousness, feel embarrassed, have negative self-perceptions because of their BFRBs. And this really can impact treatment and impact engagement and motivation. And then in terms of parent involvement and support, we've talked about this a bunch, but really treatment success may ultimately depend on the willingness and the ability of the parents to actively participate, to support, to reinforce all of the therapeutic interventions and help them be continued at home. And like we said, co-occurring mental health conditions, BFRBs often coexist with other conditions like anxiety, OCD. And so it may require an overall comprehensive approach in terms of treatment, and then in order to coordinate with other healthcare professionals. BFRBs can be chronic, they can be relapse prone, and there really can be a lot of setbacks along the treatment journey. So it's important to find ongoing support and management in order to navigate these setbacks and really maintain treatment gains. And at the end, we'll talk about some relapse prevention strategies. And finally, treatment may require consistent effort and time commitment, which really is challenging to balance with school, with extracurricular activities, and with other responsibilities in daily life. So relapse prevention strategies play a crucial role in maintaining treatment gains and reducing the likelihood of relapse in children and adolescents with BFRBs. So implementing effective strategies really can help individuals stay on track and cope with their challenges. So here are some key strategies. So for identifying triggers, it's important to work collaboratively with the child or the adolescent in order to identify specific triggers that lead to BFRB episodes. So like we talked about earlier, common triggers might include stress or boredom, anxiety, or it could even be specific situations or environments. And it's important to encourage the individual to maintain awareness of their triggers. So sometimes you can use a trigger journal to monitor the triggers as they're going along. So for coping skills, teaching and practicing coping skills that can be used as alternatives to BFRB behaviors when triggered is important. So coping skills can include deep breathing exercises, progressive muscle relaxation, mindfulness techniques, or also engaging in distracting activities other than the picking or pulling behaviors. Talked about this a bunch, creating a supportive environment. So fostering really a supportive, understanding environment at home, at school, in other settings that the child is found in, educating the family members, friends, teachers about BFRBs in order to enhance support and to reduce stigma. It's important to encourage open communication and provide opportunities for the child or the adolescent to discuss their feelings and their experiences. So in terms of self-monitoring, it's important to encourage the use of self-monitoring tools. So that could be behavior tracking charts, smartphone apps, different things like that in order to monitor BFRB episodes and their associated triggers. And we actually have a free monitoring tool in our free app. So regular monitoring, self-monitoring is important because it really increases awareness. and it really provides valuable data in terms of treatment. So if there need to be adjustments, and if you're working with a treatment specialist, you can provide them with the information as well. So for realistic goals, it's important to collaboratively set achievable goals with the child, consider their specific circumstances and their treatment progress so far. So for setting goals, it's important to take a larger goal and break it down into smaller, manageable steps, because this really helps to enhance motivation and maintain momentum. So for problem-solving skills, teaching problem-solving skills to help the child navigate challenging situations and find alternative responses to their triggers instead of the picking or pulling behaviors. And it's good to encourage flexible thinking and work together to brainstorm different solutions. And finally, ongoing support and follow-up, really to maintain regular contact, to follow up, if it's with a specialist, to continue after they're done and assess progress, to have ongoing support, and to continuously adjust the treatment strategies based on the young child or adolescent's needs and the feedback that they provide. So in summary, BFRBs, or body-focused repetitive behaviors, really, they are a group of psychological conditions. They're characterized by the repetitive grooming behaviors, and they ultimately result in the bodily damage and cause emotional distress and impaired functioning. And the prevalence rates vary. Skin picking and hair pulling rates can reach up to 4 or 5% among children and adolescents. And really, these behaviors can start as early as 2 years old, like we saw. BFRBs can significantly disrupt daily functioning. They can hinder academic performance, lower self-esteem, have a strain on social relationships, and contribute to feelings of isolation, anxiety, depression, and impact overall emotional well-being and quality of life. So we talked about psychological and emotional factors of BFRBs, like stress and anxiety and boredom, and different psychological aspects like perfectionism, emotional regulation difficulties, and difficulties with body image and self-esteem. And these are contributing factors to the development and maintenance of BFRBs in children. We talked about the emotional regulation model of BFRBs as one of the explanations of BFRBs as arising from the difficulty in regulating negative emotions and then engaging in body-focused repetitive behaviors in order to avoid or to alleviate these negative emotions. We talked about co-occurring mental health conditions like anxiety, like obsessive compulsive disorder. We talked about some common signs and symptoms, as well as the challenges of assessing these disorders in young individuals. And then we talked about some evidence-based treatment approaches like CBT, which is cognitive behavioral therapy, ACT, acceptance and commitment therapy, and really the importance of early intervention and some common obstacles to treatment. And then ultimately relapse prevention strategies like identifying triggers, using a journal to self-monitor, setting realistic goals, and the importance of ongoing support and follow-up. These are key in order to prevent relapse. So thank you for listening. I'm going to stop the recording now, and we can do some questions.